that she had ties to Akron, Ohio. And if you know who we are talking about, if you are part of that family or that this woman was visiting in Akron, or you were with this woman, if you know that she was working with an Ebola patient in Dallas, Texas, you need to call the CDC. I'm going to put the number up on the screen, 800-CDC-INFO. 800-CDC-INFO. That is directly to the Centers for Disease Control in Atlanta, Georgia. Or you can call 800-232-4636. 800-232-4636. Once again, 132 passengers were aboard that Frontier Airlines Flight 1143 out of Cleveland to Dallas-Fort Worth. It was Monday, October the 13th. That plane landed in Dallas, Texas at 8:16 Monday evening. That's 8:16 Dallas time, Central Time. Landed at Dallas Airport. It had come out of Cleveland. It is being segregated right now, being pulled out of the rotation, pulled away from the other aircraft. It is at Hopkins Airport right now, that particular airplane, and is being decontaminated by experts right now who are working on decontaminating that plane. At the same time, the CDC is trying to contact everyone who was aboard that flight number 1143, Frontier Airlines, Cleveland to Dallas, Monday evening, October the 13th. They want to talk to you. They want to check on you because of this Ebola situation. The second healthcare worker has come down with Ebola. Last night it was detected. She was working with the patient who died several days ago. She is the second healthcare worker there in the Dallas area to come down with Ebola after having worked with this patient who had flown in from West Africa several days ago. Once again, this healthcare worker, this second one, exhibited no signs or symptoms of illness while on that flight. Frontier 1143, according to the crew now. We talked to the crew on this, and Frontier is working closely with CDC to identify and notify passengers who may have been aboard Flight 1143, Monday, October the 13th. That is the information as we have it. Ohio is working with it. The Ohio Department of Health is working with it, as you heard my good friend and colleague Sarah Buttison detail just a moment ago. And we are in process of sending crews out to Cleveland Hopkins International Airport here to follow up on this story. As well, we are working on the Dallas end of this story as well. It is a story that has two ends, at least two ends, Cleveland and Dallas, and Lord knows where else it may go from there. But in the process, we want to get this information out to you. That's why we have broken into our regular programming. It is 11:43. Of course, we'll have more information as the day goes on, but stick with me on this. Is there anything else that I can report? I'm going to ask the control room now on anything we else. I want to take it back out to Sarah Butters. She's in our newsroom, and she can detail some further information. Sarah, it's yours.
Leanne, we do have this statement from Frontier Airlines, and I'm going to read some of the information here, and that is that at 1 a.m. Mountain Time on October 15th, Frontier was notified by the CDC that a customer on Frontier Airlines Flight 1143 Cleveland to Dallas had tested positive for the Ebola virus. And of course, that flight was on October 13th from Cleveland to Dallas. The flight landed in Dallas-Fort Worth at 8:16 p.m. and remained overnight at the airport. The plane did, and was cleaned that evening. Now, of course, upon learning what has happened, that a person on the plane has now become an Ebola patient, the plane has been taken out of service and has been cleaned again. We also have learned, according to Frontier Airlines, that the patient, had traveled from Dallas to Cleveland on Frontier Flight 1142 on October 10th. So let's kind of put this all in a timeline here for you. On October 10th, the patient flew from Dallas to Cleveland. While they were here, they visited family in Akron. On October 13th, they flew back to Dallas. According to Frontier Airlines, the crew told their managers that the customer, who is also the patient, exhibited no signs or symptoms of illness while on the flight. And again, that aircraft has been removed from service. And the airline says they are working closely with the CDC to identify and contact any customers who may have traveled on Flight 1143. Call the CDC at 1-800-CDC-INFO if you were on that flight, if you know someone who is on that flight, and you have any concerns or questions about your risk. And I just want to read one more part here of what Frontier Airlines is saying just here before noon today, that the safety and security of our customers, employees is our primary concern. Frontier will continue to work closely with CDC and other government agencies to ensure proper protocols and procedures are being followed. Leon?
Thank you, Sarah. And I will reiterate that Associated Press is reporting, as Sarah just said, but I want to hit it one more time. Associated Press is reporting that the woman, this healthcare worker out of Dallas, Texas, showed no symptoms during the flight on Monday. She developed a fever on Tuesday, which was yesterday. And so we are following this story now 2 days later after that flight. By the way, yesterday, News Channel 5's John Cossack went to Columbus, Ohio, and is working on a story on how the state of Ohio plans on dealing with an Ebola outbreak should that take place, or an Ebola problem should that take place inside the state of Ohio. And I think we've got some video that we want to show from John's report as he was in the process of preparing that report, and at the control room would roll some of that tape right now. We're looking at it. This is in Columbus, Ohio. State officials, state health officials, meeting together to determine how to deal with it. They are trying to come up with a plan on how to deal with this Ebola situation, which has hit us all of a sudden in the last several days. You see workers there practicing on donning the equipment that must be worn as they treat Ebola patients. 2 days ago, I interviewed Dr. Richard Besser, the ABC News medical editor, and Dr. Besser had actually been in Liberia and had seen Ebola up close and personal firsthand. He talked about the equipment that he had to don and how painstakingly they must put that equipment on, the gloves and the mask, and they must cover all areas of the skin, and at the same time they have got to be careful as they take it off. As they take it off there, the clothing is being decontaminated as they remove it, and they must remove it very quickly. The newsroom tells me that John Cossack, News Channel 5's John Cossack, my good friend and colleague, is on the telephone. John, let me bring you into the conversation. Your thoughts on everything that we've been reporting on today.
Well, Leon, literally just finding out about this morning, but I spent all day yesterday down in Columbus with the state's emergency and healthcare leaders. They were going through their emergency drill on what to do in the event that Ebola ever found its way into Ohio. At that point, they saw no imminent threat, and they felt that these were procedures that they would never have to put into place. But nevertheless, they are in a position, should they need to go into action, to do what they would need to do. And they went over those procedures yesterday. One of the procedures that they went through different scenarios. One of them was with a patient presenting in Columbus. One of them was a patient who flew into Cleveland and presented in that case, and what they would do and the procedures that they would follow. And they went through these scenarios, again, not feeling that they would ever have to put them into place, but they wanted to know, when you go through something like this, it raises questions that maybe you wouldn't have had unless you're in a room with, and there were 60 leaders of different healthcare, doctors, nurses, the Morticians Association, National Guard, all these people, and they began discussing and talking about, okay, if this, then this. And so they feel they are in a position to handle anything that is thrown at them, but they felt that, they would never have to put those into practice.
Interesting, John, that there were mortician officials there because of the possibility of an Ebola outbreak. Speak to that about the morticians being there, the people who deal with the dead.
Yeah, the Coroners Association was there, the Funeral Directors Association was there, because there are direct procedures that the CDC wants everyone to follow once someone with Ebola dies. And we saw it in Dallas with the first victim that passed away there. He was cremated right away. Mm-hmm. No autopsy. They want to limit contact to whatever they can. So again, these are procedures that they had in place for H1N1 and other viruses. So they're just basically following the blueprint and going over. And we talked about it yesterday. There is no one hospital in the state that they would send patients to. There are 219 hospitals in Ohio, 13 health systems, but they are holding all to the CDC standards of being prepared to handle a patient walking in. The main concern yesterday that came up was somebody going into not a hospital, but maybe an urgent care, presenting with symptoms, or one of these mini clinics at local pharmacies. And what would we do then? So these are things that they all talked about. And as somebody from the hospital association told me, in a time of a crisis is not the time to be handing out business cards. They wanted to get in one room and find out who they would be dealing with, who they would be answering to, so that if anything ever happened, all that stuff is out of the way. They can hit the ground running.
One of the things the government said the other day was, and this is a phrase that came out of federal health officials, was think Ebola, wanting all hospitals to think Ebola. Of course, a lot of hospitals may not be prepared to deal with this situation, but I guess we are being forced into dealing with this situation. You would agree with that, wouldn't you, John?
Without a doubt. And I think what happened in Dallas a couple of weeks ago when the first victim presented was turned away and sent home, that was a wake-up call to everyone, every hospital around the country, to get on their own people to make sure that they are able to deal with this. And I think we saw it in some of the local hospital systems. I know in the emails and stuff that went out immediately. And I think it was a bad thing that it happened, but it was a good thing that it happened because it got everyone thinking right away, what do we do?
Dr. Richard Besser, with whom I spoke, whom I interviewed the other day, who's the chief medical editor for ABC News, told me, John, that he did not think that there would be a widespread outbreak of Ebola in the United States because of the precautions that have been taken. But we are trying to make sure that that indeed is the case, that that does not happen, that there is no widespread outbreak. But even a small outbreak like this sends a wave of, I hate to use the word, of panic through the community. How do we address that, John? What do you think?
We talked about it yesterday down in Columbus. This needs to be a plan that is set in stone, but is not inflexible. And I think, if it was a plan that was set in stone, you wouldn't have healthcare workers that are affected. And the fact that, you have two, all of a sudden changes the way you're thinking this. We're approaching this wrong. And so that I think this is a constantly evolving thing. And I think Dr. Richard Besser was spot on at the time when he said that. But, things change. And as more people become infected, you got to look at it a little differently.
Yeah. John, I want to ask you to hang on the phone, if you can hang on the phone, because one of our reporters is out at Hopkins Airport.